Welcome back. You're now watching the lifestyle segment of the weekend show brought to you by HoloCrunch.
Yummy, crunchy goodness. Good morning.
Good morning. So we'll be discussing again this week healthcare waste in a COVID-19 era, but we'll be particularly focusing on what the FCT is doing. As we all know, adequate management of healthcare waste is a prerequisite for efficient delivery of healthcare services. In Nigeria, there are several constraints militating against proper management of healthcare waste. This is raising some environmental concerns among stakeholders in the health sector. On today's episode, we analyze the practices of healthcare waste management in the FCT. Joining us to discuss this, we have
Aniebiet, the project manager, Stewards of the Environment for Sustainable Change Initiative. Welcome to the weekend show.
Thank you for having me, Andy.
Also joining us is Director Solid Waste Department of the Abuja Environmental Protection Board, Mr. Amos Odunfa. Welcome to the weekend show, sir.
Thank you very much for having me.
Our pleasure.
Awesome. So, Mr. Odunfa, let me start with you. So, what is Abuja doing? What are we doing in the FCT to manage healthcare waste?
Thank you very much. A lot is being done to manage healthcare waste, because we know that healthcare waste is a sort of a special waste compared with other general waste, especially in the sense that it is contains a lot of hazardous and infectious waste. Taking that into consideration, we have to put in place a policy for effective management of this healthcare waste, and that policy is being followed as much as possible. And to ride on that is the fact that we have ensured good collaboration with Health and Human Services in the FCT. These are the arm of the FCT government that is controlling hospitals, managing hospitals, and directing the affairs there. We know that we cannot do that alone without collaborating with them. So the policy was jointly developed by AEPB and the Health and Human Services Secretariat of the FCT. And then we are interfacing with the healthcare waste facilities to sensitize them on the best way to manage their healthcare waste, or the practices that they're supposed to put in place, and some other such as adequate waste containerization, color-coded lining, or color-coded waste bins, as the case may be, proper storage of their waste in their facilities in preparation for collection or disposal. We encourage many of them that can afford it to provide an in situ kind of disposal facility, like incinerator, and many of them they know the importance of this, and they cooperate with us, and they are doing as much as possible. Apart from that, we recently this COVID-19 era, we involve the private sector in the collection of the waste from the healthcare waste facilities. We know and we believe that they will be able to handle that segment of waste more professionally, and they will have a quick response to emergencies. And so we involve we engage 3 of such to collect healthcare waste in the healthcare facilities within the city.
Okay.
And a lot of other things.
We'll dig deeper into that, but let me bring Aniebiet in. You are part of the Stewards of the Environment for Sustainable Change Initiative, and you have this initiative called Stop, Don't, Drop. We get a lot of talk about these things. We see a lot of movements on social media talking about climate change, protecting the environment. What impact so far has your organization, your initiative achieved since it started this initiative? What impact have you had so far?
All right, thank you very much. So we initially started based on an issue and a challenge that we saw in 2015, where we saw the massive waste pollution that is happening at the Usuma Dam. So that was what gave birth to us. So we got in contact with the FCT Water Board and also Abuja residents, and we embarked on a massive campaign to clean up the Usuma Dam. And what we discovered there was there were lots of waste ranging from medical waste, plastic waste, and all sorts of waste in the dam. So what do we have to do? We said, okay, let's clean this thing up and see how we can make the environment cleaner. Now, all of this waste were found in the untreated water. The FCT Water Board does treat the water that we eventually get into our taps and all of that. But just seeing that site alone is kind of scary. So that was why we engaged in that cleanup. And in fact, we're just able to clean some parts of it while the FCT Water Board engage regularly in cleaning that place up. And that actually adds to their cost of maintenance and all of that. So we got a grant with the Henrik Boll Foundation to carry out a study on how this waste is even coming into our water stream. So that was when we found out that most of the waste are made up of healthcare waste, and they mostly come from the Mpapi axis and the waterways, which leads it eventually to the dam. So we carried out a research, and we found out that lots of healthcare, there's a gap in the management of healthcare waste. So when the healthcare waste is not properly managed from the facilities, eventually ends up in the dam. So that was why we started. And since then, we've been able to raise awareness, starting with the Mpapi residents, telling them about the need to actually take care of their environment and protect it. We also engage communities as well in the FCT and telling them that, see, our name stands for Stop, Don't Drop. So when we meet you, we say you should stop and
but
don't
just
drop.
to be clear, Aniebiet, so is the problem from the healthcare facilities or the organizations and companies they get to dispose this waste? Where did you identify this problem? So is it from the healthcare facilities? Because if they pay people to dispose of this and those people take it wherever, and you now come and tell the residents, oh, clean this up, where is that gap? Is it the healthcare facilities, the companies in charge of disposing it, or the people in the environment?
Okay, I think it all boils down to three of them. So from the healthcare facilities, not all of them manage their waste properly and actually get the right people like the AEPB to dispose of the waste. Some of them just take it out and dump it anywhere. And we know what happens when rain comes in. It washes everything and goes back to the water. So, yes.
Let's bring in Mr. Habib Adamu here, lecturer at Kaduna State University and an environmentalist. Good morning and welcome to the Weekend Show.
Hello, good morning.
Awesome. Thank you for joining us. So talk to me about the study you had in 2019 and just help me position yourself in the middle of the camera so our viewers at home can see you properly. So talk to us about the study you conducted in 2019. What were the key findings about healthcare waste disposal?
All right. Good morning once again. Last year, 2019, we were commissioned by the Japan International Cooperation Agency to conduct a study on the management of healthcare waste in the FCT. And during our study, we were able to look at the management of this healthcare waste in the 30 healthcare facilities within the FCT, and comprises of all healthcare facilities ranging from hospitals, that is the public hospitals, the private hospitals, pharmacies, medical laboratories, and specialized clinics, that is consulting clinics. And what we found is, just as Aniebiet mentioned, there are gaps in the management of this healthcare waste. Although I will say the Abuja Environmental Management Board is doing a lot, because from mere mentioning of the name AEPB, the healthcare facilities get jittery, because they know one way or the other they are not doing the right thing, and AEPB will be on their neck. And what we're able to see is that these healthcare waste are supposed to be managed in a certain manner that is ranging from the point of generation up to the point of disposal. And the right channel that's supposed to be followed is the waste at the point of generation. The healthcare workers are supposed to dispose them of in color-coded refuse bins, which will be collected and taken out of the facility and stored within that same facility in larger containers, and then treated where necessary, and then collected by Abuja Environmental Management Board trucks and disposed of at the appropriate disposal site. Now, where the gap lies is between those who are generating the waste and not disposing of the waste correctly. Some of the waste are found in the wrong containers. And then secondly, during collection and then disposal in the right large collection bins within the facility before collection by AEPB, they are also not disposed of rightly. And then again, during collection by AEPB, the collection is done together, that is, without regard to segregation that has been done by the healthcare facilities. And then when taken to closer dump site where it will be finally disposed, there's no form of any treatment taking place there. The waste are disposed of together. That means the entire chain of the management has been done in a way not supposed to be done that way. And this is where the gaps are actually lying. And as a result of that, we're able to discover that majority of the waste generated are general waste, with just a little of infectious waste, a little of sharps, and the likes. Although we know that according to WHO, about 75%, about 10 to 25% of the waste that are going to be generated from healthcare facilities are the only part that are infectious. That is, we can look at from 75 to 90% as general waste, which means that the treatment of this 10 to 25% is not going to be too much of a burden if properly managed. But the problem that we're facing is that the waste are not properly segregated from the point of generation to the point of disposal. And that poses a risk, because the infectious waste, when mixed up with the general waste, makes the entire waste to be infectious or to be hazardous. And as such, their disposal at the disposal site, their collection, the entire chain is being compromised. As such, the health workers are at risk, the environment itself is at risk, and that's where the problem lies. So there are a lot of gaps in the management of healthcare waste in the FCT. Although, just as I said earlier, AEPB is doing a lot, but there's still more. Yes.
So something bothers me, and this is the well-being of the healthcare workers, the handlers and the evacuators, who it's their duty to dispose of this. I personally, and I may be wrong, haven't seen any of these color-coded disposable or disposal units in town. But with the people who handle these waste and the materials, what can be done to ensure that their own safety is a priority? Because if they know that they could get infected as a result of handling this, it becomes easier for them to just dispose of it in any way, just to get rid of it. So how can we protect the handlers, the healthcare workers, and the evacuators who have direct interactions with these infectious waste and healthcare waste?
Okay, first thing first, I think the first thing that need to be done is to get them aware. Danger they are at, what type of waste they are handling, what are the potential risks they are exposed to. Then secondly, they need to be prepared. They need to be provided with the right personal protective equipment, right? And they need to be with the right protective equipment and the level and awareness, and also training on how to handle this type of waste. I think it will go a long way to protect them and to safeguard them from the risks of this type of waste they are handling. And these are the these are the key things that need to be put in place for this to be put under check.
Thank you, Habib. Let's come back to the studio now, Mr. Odunfa. As director of AEPB, the Abuja Environmental Protection Board, you've heard Mr. Habib clearly express that there is a huge problem in the entire value chain, from the generation to the collection to the disposal. There's a huge problem. So you answered earlier on what you are doing, but it seems that you're not doing enough. So what is the gap? What is stopping you from putting proper measures in place to improve this value chain of healthcare waste?
Thank you very much. The healthcare waste management and waste management generally in Nigeria, as is also in FCT, is a work in progress. Some of the gaps that Mr. Habib noted they are not disputable because they are reality, and we are aware of this, and that's why we are doing our best to be able to manage the situation and minimize the hazard. And some of the things that we are doing is just as I told you that we engage some private companies that we know that they are competent in handling this, but that's not enough, because waste management actually starts from the source of generation, and that's from the wards, from the theater, and the various departments and units in the healthcare facility. The policy on healthcare waste management in the FCT expects the healthcare facility, each healthcare facility to provide the various containers, either waste bins or waste bags, color-coded according to the recommendation of the WHO. So we hold them responsible to provide that in their facilities, and also the training of their workers and the engagement of the appropriate, qualified waste handlers, their cleaners, and all those things. They are expected to do that. We are monitoring that, and their operation. We visit them. We have various levels of supervision and monitoring. We have a special unit in the AEPB that goes around the healthcare facilities to make sure that they segregate their waste appropriately, and then these waste collectors, they go there, and we also ensure that they are provided with appropriate personal protective wares, and all that we do. With the engagement of the private sector, we also ensure that they maintain separate stream of collection of this waste. Just as Mr. Habib said, that just about 10 to 25% of the waste generated in a healthcare facility is hazardous. It's very small, so we ensure that they collect that separately. And not only that, even before, especially with the arrival of the COVID-19 pandemic, before they even touch any waste in the healthcare facilities, they decontaminate this using some chemicals, and that they collect and then they take to the dump site. At our dump site, this the final disposal site. That's one of the areas where we have a huge gap because of the deficit in the infrastructural facilities for the final disposal of this. However, recently, we, in collaboration with one of the major hospitals in FCT, we developed an incinerator to be able to take care of some of these hazardous wastes after being collected. As I speak, there's one. That incinerator is installed at our final dump site now, even though the capacity is small. To be able to, not adequate to handle all the healthcare waste, but at least we cut out some part of this healthcare waste so that we can be able to handle it in that, especially the sharps.
Mr. Odunfa, I see a lot of responsibility to handle this being placed on the external organizations and the private organizations who are responsible for managing this disposal. The Abuja Environmental Protection Board in Abuja, after the police, people are scared of them. Like, I see street hawkers, I see a lot of enforcement going on for illegal businesses and the likes. In this case, a lot of this burden is now put on these private organizations and agencies that are meant to dispose of this. Do you have a proper schedule for when they come to dispose of health waste? So what day of the week does this happen? And also, what parts of town, in your enforcement and your monitoring, have you noticed that there's a bigger problem, and in which areas is it better? So we need to be able to evaluate the impact by saying, do you have a specific schedule for when this happens? And what areas do you have these issues going on?
Yeah, the collectors,
Yes.
they have their work schedule. And they have their program, they work they work all the days of the week. And so they have their schedule where they will cover on Monday, for instance, where they will cover on Tuesday, where they will cover on Wednesday, and then they repeat, because they repeat the cycle again, because it's expected that at least with proper segregation and containerization at the healthcare facility level, it's not practicable to be going there to collect waste every day. So they have to schedule that at least 2 or 3 times in a week they collect waste from a particular healthcare facilities, and they are following that. We are monitoring that to ensure that they cover that. As to which part of the city they cover the entire city. In AMAC, we have, apart from the public healthcare facilities, that is general hospitals, we have private healthcare facilities, almost 400, more than 400 of such. And they are they are distributed all over the part of the city, Gariki, Wuse, even up to Kubwa, Lugbe, Yanyan, Jikoi, and all that. So they have their schedule is to cover all this, and that's why we engaged 3 of them. The city was divided into 3. So each of these private sector takes care of the healthcare waste in the areas of their coverage.
Okay, I'll take that as your final words. Let me ask for your final words as well. From the study that you did, sponsored by the Henry Boyce Foundation, what have you, or what suggestions or what solutions would you prefer to the key stakeholders in this healthcare management, healthcare waste management sector? What solutions specifically would you prefer to the hospitals, to the PB, and other key stakeholders?
Okay, so for one, I think the first thing healthcare facilities need to do is to incorporate waste management plan into their yearly budget. So you see, waste management is like an afterthought of caring for patients or the facilities. So they actually fail to realize that caring and treatment of patients is not only administering drugs to them, but how is the waste handled afterwards. So that's the first thing I think the healthcare facilities need to pay attention to, and they shouldn't do it alone. They should incorporate bodies like the APB, the Human and Health Services, the Hospital Board Management, even the Ministry of Health and the NESRA as well. So all these people can work collectively to now know that, okay, we can do it this way. Then another thing which Mr. Odunfa spoke of is there is a national healthcare waste policy, but it has not been implemented into a law. So for me, I see that as not giving them the right power and authority to actually enforce these laws. So these people, they're just asking them that, okay, you should do this because this is the guideline. But there is no national, it has not been implemented. So if that is implemented, I'm sure the healthcare facilities will sit up. Then another thing which is key, which Mr. Habib mentioned, is training. And this doesn't stop. It doesn't stop just once. It's not just a one stop. You have to do it consistently and regularly. So the healthcare workers can know how to segregate their waste, because if they don't do that, they put themselves in harm's way, and they also put the lives of their families and the environment also at harm's way. Then I think there also needs to be regular assessment of these places. So every time the AEPB should always go there. So we should have them go in there consistently to monitor them, just like they do for the street hawkers on the streets.
I like
so
how he's
really
looking at
appreciate
Mr.
that.
Odunfa.
Yes,
like,
while
Mr.
he's
Odunfa, it's on your organization. It's on your department.
Habib, your final words?
Well, Aniebiet has spoken a lot, and he has spoken about so many things I would have loved to see. I think I will say, according to WHO again, 23% of deaths that occur annually are associated with wrongful disposal of this hazardous waste. That's to show the level of danger that is associated with poor management of this healthcare waste that are generated from healthcare facilities. So there is really so much to be done from the healthcare facilities up to the authorities that are in charge of overseeing the affairs of these healthcare facilities. According to the guidelines, there is so much that the healthcare facilities are supposed to do with regard to their waste before it's even collected by AEPB. They are supposed to have a form of treatment for their waste before it's being collected by AEPB, either in form of incineration, either in form of destroying their shafts, or in form of disinfection disinfecting those waste that are infectious before they are finally collected by AEPB. And then at AEPB level, the final disposal of this waste is not supposed to be done general. From collection, if they are collecting this waste, the waste are supposed to be collected in designated trucks, clearly marked as hazardous, clearly marked as hazardous waste. And then when taken to the final dump site, it should be disposed in such a manner so that these scavengers don't have access to it. Because just as Aniebiet mentioned, people are going to endanger their families. This waste is going to seep into the ground and contaminate underground water. Some of it is going to get washed into surface water. So the level of contamination is going to spread so much: underground water, surface water, infections at home, air pollution, etc. So it's going to be so much. So I will call on AEPB to at least, they are doing so much, but more need to be done. And then another thing AEPB need to do is that they need to be more firm on these healthcare facilities to manage their waste properly, to segregate this waste, dispose them uprightly, and then the cleaners should be educated and should be provided with the right personal protective equipment to safeguard them. And with this era of COVID-19, it puts so many people at risk. Not just the isolated.
That's a fine place to leave it. Sorry. Thank you so much for your time, Habib. Thank you, Aniebiet. Thank you, Mr. Odunfa, for your time and coming here to discuss this very integral topic with us. That's all for the lifestyle segment. We'll take a short break. When we return, more on the weekend show. Don't go anywhere.